Ladies and gentlemen, esteemed medical students, welcome to today's lecture on the complex and fascinating topic of pulmonary embolism. In this comprehensive script, we will delve into the various aspects of pulmonary embolism imaging, diagnosis, and treatment. So let us embark on this journey of knowledge as we explore the exciting world of radiology in relation to this life-threatening condition. To begin our exploration, we will highlight the significance of quantitative assessment of pulmonary embolism using CT pulmonary angiography, CTPA. This imaging modality plays a crucial role in the diagnosis, management, and follow-up of patients with suspected or confirmed pulmonary embolism. CTPA allows for a detailed visualization of the pulmonary vasculature, thus aiding in the identification and characterization of emboli. We will discuss the different quantitative parameters, such as clot burden and right ventricular to left ventricular diameter ratio, that can be derived from CTPA and their clinical relevance in assessing disease severity. Moving forward, we will explore the capabilities of dual energy CT, DECT, in enhancing the detection and characterization of pulmonary embolism. DECT utilizes different energy levels to obtain more detailed information about emboli, their composition, and perfusion defects. This technique improves the diagnostic accuracy of embolus identification while minimizing artifacts and improving image quality. We will discuss the advantages of DECT in increasing sensitivity and specificity, as well as its potential role in risk stratification and treatment decision-making. Next on our agenda is magnetic resonance angiography, MRA, and its utility in the diagnosis of pulmonary embolism. MRA, with its non-invasive nature and lack of ionizing radiation, offers an alternative to CTPA in patients with contraindications to iodinated contrast agents. We will delve into the strengths and limitations of MRA, discussing its diagnostic accuracy, ability to assess coexisting pathology, and its role in evaluating chronic thromboembolic pulmonary hypertension, TEPH. Shedding light on an important aspect of pulmonary embolism diagnosis, we will discuss the challenges in diagnosing subsegmental pulmonary embolism. These tiny emboli are often missed or underestimated, leading to potential complications and mismanagement. We will explore the role of advanced imaging techniques, such as CT pulmonary perfusion imaging and dedicated subsegmental arterial evaluation, in improving the detection and characterization of these elusive emboli. Addressing the unique challenges presented by pulmonary embolism in pregnancy, we will examine the imaging considerations, management approaches, and potential risks to the mother and fetus. Maternal physiological changes during pregnancy pose diagnostic dilemmas, and the choice of imaging modality must prioritize maternal and fetal safety. We will discuss strategies for optimizing imaging protocols and the use of alternative imaging techniques, such as ultrasound and ventilation perfusion scintigraphy, to minimize fetal radiation exposure. This section highlights the crucial role of imaging in assessing right ventricular dysfunction and acute cor pulmonale and pulmonary embolism. Echocardiography and cardiac magnetic resonance, CMR, imaging play significant roles in identifying changes in right ventricular size and function, helping to risk stratify patients and guide treatment decisions. We will discuss the various imaging findings, such as McConnell's sign, and their implications in assessing the severity and prognosis of pulmonary embolism-related right ventricular dysfunction. Moving on, we will explore the importance of optimizing and individualizing imaging protocols for pulmonary embolism. Patient-specific factors, such as renal function, body habitus, and previous imaging examinations, need to be considered to minimize radiation exposure, contrast-induced nephropathy, and optimize diagnostic accuracy. We will delve into the principles of dose-length product, DLP, iterative image reconstruction techniques, and the role of dose reduction software in achieving these objectives. Highlighting the role of imaging in monitoring treatment response and identifying complications, we will discuss follow-up imaging modalities such as CTPA and Doppler ultrasonography. We will explore the imaging features associated with successful treatment outcomes, including recanalization of pulmonary vasculature, resolution of thrombus burden, and improvement in right ventricular function. Furthermore, we will discuss potential complications, such as pulmonary infarction and chronic thromboembolic disease, and the imaging modalities used to identify and manage these complications. Turning our attention to treatment options, we will provide an overview of surgical and endovascular interventions available for the management of massive and submassive pulmonary embolism. We will discuss the indications, advantages, and limitations of therapies, including catheter-directed thrombolysis, surgical embolectomy, and inferior vena cava filter placement. Imaging plays a critical role in evaluating treatment response and identifying procedure-related complications. In this era of technological advancements, we cannot disregard the potential of artificial intelligence, AI, and machine learning, ML, in pulmonary embolism detection and diagnosis. We will explore the current and future applications of AI and ML algorithms in improving the accuracy and efficiency of embolism detection, risk stratification, and treatment planning. We will also discuss the challenges and ethics associated with integrating these technologies into routine clinical practice. Shifting our focus to the pediatric population, we will examine the unique challenges and management approaches in pediatric pulmonary embolism. Diagnosis and treatment considerations differ significantly in children due to their anatomical and physiological differences. We will discuss the role of imaging, including ultrasound, CTPA, and ventilation perfusion scintigraphy, in the evaluation and management of pulmonary embolism in pediatric patients. In our penultimate topic, we will uncover the emerging field of molecular imaging and its applications in evaluating thrombus composition and activity in pulmonary embolism. Positron emission tomography/computed tomography, PET/CT, provides valuable information about the metabolic activity, inflammation, and composition of pulmonary emboli. We will discuss the use of specific tracers, such as FDG PET, in assessing treatment response, identifying high-risk emboli, and guiding targeted therapies. In conclusion, pulmonary embolism diagnosis and treatment rely on the continuous advancements in radiology. By employing a multidisciplinary approach, radiologists play a crucial role in detecting, assessing risk, and monitoring treatment progress. We hope this video has expanded your understanding of this critical field. Keep exploring radiology.